Doctor, can you explain to me how someone like Dr. Fauci or someone like Bill Gates, who are there to, they're technically there to protect the public good, can also have patents on some of these vaccines or even viruses? It seems like a massive conflict of interest to me that could be the case. And yet, when I read it, it seems to be the case.
It is the case, and that changed in the early 80s with something called the Bayh-Dole Act, Bayhdole. This was the senator from Utah at the time, and Bob Dole, I believe he was in Virginia at the time. But in the 80s, that act gave government workers and university people who were supported with taxpayer grants the opportunity to patent their work. And really it's taxpayer funded, it's taxpayer, they turn on the lights, they give us everything, they pay for our educations, they pay for us to go to the meetings. And when I heard of that, I was a young scientist in the early 80s. When I heard that act and I experienced what it did to research, it ruined collaborations, it ruined everything. Discoveries were held up in courts while people decided who had the patent rights and who owned the discovery. And this was the case with HIV, where millions around the world were infected and ultimately died as that pandemic spread around the world because the testing with the diagnostic test wasn't done. Wasn't made or made available as the NIH officials were arguing with the French officials, heads of states, over who patented the virus and the detection methods. Think about the testing. Think about how much money these tests are. And it's really not just Tony Fauci. It's the heads of the FDA and the CDC who continue to cover up this, and the FDA who prevent natural product drugs and other drugs like some that I've worked on. We've worked on them for 15 years, and they're far more safe and they're far more efficacious, and yet they won't be approved while other drugs like opioids that we know are deadly are fast-tracked, and these vaccines are fast-tracked at alarming rates. Well, yes, it's alarming because they're not tested.